Welcome to our INCA Evo presentation. Northern Queensland Primary Health Network acknowledges the Aboriginal and Torres Strait Islander peoples as Australia's First Nation peoples and the traditional custodians of this land. We respect their continued cultural support and spiritual connection to country, waters, kin and community. We also pay our respect to their elders, past, present and emerging, as custodians of knowledge and law. We are committed to making a valued contribution to the well-being of all Aboriginal and Torres Strait Islander peoples of Northern Queensland. I'm Debbie. I'm the Senior Primary Care Project Officer from the Mackay office. I'd like to now introduce Emma Walker from Precedence Healthcare, Head of Consumer and Strategic Partnerships, and has been with the company for almost 4 years. She's also a registered nurse with a background working in private and public sector. Welcome, Emma.
Thanks, Deb. Thank you so much to the PHN for having us. Also on the line with me is my colleague, Tonya, who is just here to back me up if we have any curly questions. So thank you very much, everybody, for joining us, and thank you to the PHN for popping this session on. Today, what we thought we would do is show you a demonstration of the new INCA product that has just recently launched. So just to give people a little bit of background, I know there are some familiar names on the call, but just for people who aren't aware, so Precedence Healthcare has been around for probably about 17 years, and we've been developing shared electronic care planning solutions for that time. So you've probably know or heard about our previous product INCA, which we're now calling INCA Classic, which is definitely still around and still available for you to use. However, we have recently just launched what we're now calling INCA Evo. So thank you to the PHN for allowing us this opportunity to show everybody our newest product. So I'll just quickly share my screen and I'll get that up and running, and I hope everybody can see that there. I'll run through the presentation. It will probably be quite quick, but then I'm happy to open it up for any questions and any discussion as well. So INCA Evo was launched back in May, so actually at the RACGP Practice Owners Conference in Cairns. So it was launched in North Queensland as well. So we developed this solution purely based off a lot of clinical feedback that we have from our old INCA Classic program. For anybody that has used INCA previously, there were a couple of pain points that came from it. So, and as you can see, we've done a lot of work, as you will see, we've done a lot of work to try and enhance those pain points and minimize those pain points. So we actually interviewed over 200 clinicians back in January this year, practice managers, nurses, GPs, and we got a lot of feedback. We really wanted this product to be in line with what the clinician uses. So we work solely with the clinician. We listen to them. We don't just want to be the company that makes the decisions ourselves. We want to know what the users want. So that's kind of what we've based this INCA Evo product on. For now, INCA Evo currently integrates with best practice. So we did a lot of work to integrate closely and co-design with best practice. So that's sort of what we're starting off with. In future, INCA Evo will also integrate with all of the other practice management softwares as well. So Medical Director, ZMed, and hopefully Communicare in the future. But also our INCA Classic product, if you're not aware, it still does integrate with all of the practice management softwares at this time. So if you're not a best practice user, you can also still use our INCA Classic product. So basically, we designed this product so that the user doesn't have to leave their workflow. So as you can see, there's a blue bird on the side of the window there. You can move that bird up or down and get him out of your way, but he'll just sit there and he'll basically read whenever a patient is open in your clinical record. So once you open the patient in best practice, as you can see, there's a little number, a yellow number there. That's alerting you that this patient may be eligible for a GPMP or a TCA or a review. Now, it has some smarts where it looks at the chronic condition of the patient. So if a chronic condition has been recorded, it will look at that information. It will also look at your billing as well. So it will take a look and check if a 721, for example, has been billed in the last 12 months, and will make recommendations based on that billing information as well. In the future, what we also hope to do is provide an integration into Proda. That's something that we're looking at developing on our roadmap at this stage, so that it will also look at previous items that have been billed as well. But for now, it's looking at the chronic condition plus also the billing in your system. Once the user is ready to, what they can do, if they choose to, they can slide open the INCA Evo bird. And as you can see, you'll have some recommendations there. So we're starting off with a care plan and a review that's in the system, and the user can then choose what they would like to complete for this patient. So the beauty of this INCA Evo application, and as I mentioned, we wanted to make sure that this was developed so that the user didn't have to leave their workflow. So that was one of the big pain points that we got from a lot of clinicians back in January, that they didn't like stepping out of their current workflow. So INCA Evo is developed to seamlessly sit alongside of your practice management software, so that you can still work in your practice management software and then also INCA at the same time. What you can do is you can click on start, and basically in order to create a care plan, you can do it all from this window here. So using the INCA Evo application, you're able to seamlessly create a patient-centered care plan for the patient based on the conditions that are listed in your practice management software. INCA has built-in clinical algorithms where it will pull the conditions from your practice management software. So as you can see here, this patient has diabetes, osteoarthritis, and hypertension. So it brings that into the application, and it then uses those clinical algorithms.
Just logged into the INCA Evo while I'm sitting here.
I think that's Collinsville. It then creates those INCA goals and activities as well. So without having to sit there and type the information, you're able to then generate a care plan for the patient. So the idea behind this is, without the nurse or the GP having to sit there and type every single thing, they could actually instead just make small changes and personalize this for the patient. They can decide whether or not, for example, this is too much for this patient. I might change it to 15 minutes. Some of these may not be necessary, so I might delete them altogether. But I might also want to pop a couple in there as well for this particular patient. So I can also type in some of my free text goals as well. So we really designed this platform with the idea in mind as well, with the upcoming changes in November, keeping in mind that GPs may need to do their own care plans, and they may need to do them opportunistically. So we didn't want to make this too complex. We know that care planning and billing is already complex enough. So we've really tried to streamline the process and streamline how easy it is to complete a care plan. So easy that a GP could do it, and if not, a nurse can also do it as well. So underneath here, the other biggest piece of feedback that we got was having to utilize the INCA address book plus also your own address book was like a duplication, and we completely understood that. So the INCA Evo application actually connects in to your own address book in your practice management software. So instead of having to add people into INCA, for example, if you've already got providers in your BP address book, you simply then would use the INCA Evo application to add them in. So it actually connects into your address book. As you can see, it still does make, for example, the recommendations on specialists that potentially should be in this care plan. However, you can always remove these providers if you don't want to, and you can then assign your providers that you would like to have in this care team. I'll go ahead and pop some in just for the purpose of the demonstration. And then once I've got my providers in there, as you can see, any providers that are eligible, we can also assign the allied health referral visits from here as well. So as simple as just popping in a number, we'll pop in maybe one for the podiatrist. Oh, I've got two podiatrists, so I'll pop in one for the top podiatrist there. And I could pop in another one for the below podiatrist as well. That will actually automatically and electronically generate your allied health referral forms. So that will create them, date them, put all of the necessary information in, and it will also, as you can see on the right-hand column there with the share box, it will also automatically share off to those providers as well. So based on the method of contact that is listed in the address book that you have for that provider, whether it be email or fax, INCA will automatically send off that documentation. If it's sending via email, it's of course sending it encrypted and password protected, or alternatively, if they don't have an email address on file, it does also automatically fax off to those providers as well. You can choose who to share the care plan and the TCA with as well. So for example, you may have a specialist in there who is an extra member, but you may not want to actually share the documentation with them. You can simply untick that information and that then won't share that documentation with them. Alternatively, if you do wish to share it with them, for now, until the changes come in place in November, we're sending off a bit of a cover letter with them, and it also gives them the opportunity to agree to be a part of that TCA as well. They can then fax that or email it back and communicate back to you in their regular process, so that they don't have to have an INCA account. They don't have to log in. So another pain point of INCA Classic is getting your providers on board, and we completely understand that because there are so many systems out there. So this system sort of takes that pressure away. So we will automatically fax it and email it off to the provider. However, then they're able to send it back however they wish to in their regular communication. And that, of course, may all change come November 1. So that's what we're preparing for as well. So until we're told, we will still continue that. But that's what we're also preparing for. So that's the providers and the sharing section. I can also pop in some notes here as well. So I'll pop some notes here. They will be input into the care plan. And for any INCA Classic users, you're probably thinking this is very, very streamlined. It's a lot smaller. That is the case. But what we've done is we've just reduced all of the noise. So as you see, when I will complete the care plan, we will still pull all of the necessary data from the clinical record that you need for a care plan. So we'll still pop in their latest measurements, pathology, if it can be found, past history, active history, etc. It will still go onto the care plan. But as you can see, the UI of this actual application is a lot more streamlined and there's less for you to have to do. So you can almost do it in just a few clicks if you need to. I can set a date for a review, so I'll pop one in. By default, it does have a date. And as I mentioned, because we're just preparing for those upcoming changes in November, we'll include the TCA documentation with the item number on it at this stage. So I have the option now to finalize this documentation. And as I said, if you do have a nurse, for example, your nurse could complete all of this information for your GP, and the nurse could then release it to the GP to approve or finalize, depending on how your appointments work, or they could just continue on and approve on behalf of the GP if the GP has given verbal approval. So I'll click on finalize. And another big thing about what INCA Evo now does is that instead of the user having to manually download documentation, it automatically will send your documents straight back into the PMS. So it sends it straight back into correspondence out, keeping your medical record compliant and fully up to date with all of the documentation. So INCA Evo actually isn't storing any information now. We just send it straight back into your PMS. The other thing that INCA Evo has been enhanced with is as soon as you click on finalize, the patient will also receive a notification either via email or SMS with a link to those documents. So without having, if they don't want it, they don't have to use it, but it will still automatically send them a document, those documents, so they can take it with them electronically as well. So that's all done now. I'll just take you over, and what I'll do is I'll quickly show you in correspondence out, for example, some of the information. So this is one that I did just earlier today. So this is my GPMP. And as you can see, I mentioned that it does pull across all of those medical conditions and the medical history and the past history, etc. It just doesn't put it in that application, so you can't see it. But as soon as you hit finalize, it will actually pull across any up-to-date information. And then as you can see down the bottom here, we've actually got our care plan goals and just any of those notes that I popped into the care plan. So that's our document there. It's all finalized. And as well as the TCA will also be there. I'll just do a quick, this one here. I'll just bring this one up. And this is my allied health referral form as well. So this patient is Aboriginal and Torres Strait Island. So this one is the document that we're using. So all electronically authenticated and signed by the GP and then stored back in the PMS. I might just stop there and just see if there's any questions at this stage before I move on to the reviews.
We've got one there, Emma, regarding one of the practice managers. Can we make it so it doesn't send it to the patient automatically if they request not to send them the documents?
Yeah, that's some feedback that we've previously had as well. So that's definitely something that is in our roadmap, to be able to turn off and turn on those notifications for patients. So at the moment, it is automatic. It still will send the email to the patient, but we do have it in future mapped out so that we can turn that off either at a clinic level or a patient by patient level as well. So it's definitely something that we're looking into.
Mm-hmm. Jen?
Yeah, Emma, I was just wondering if you're working through and you notice that there's something that's not right in the clinical notes, can you like change that and it just automatically will update, or do you have to refresh?
No, that's a good question. So, yep, and that's, I should have mentioned, sorry, but that was the whole idea about INCA Evo, is that will often happen, is that, say, for example, you want to, pop in a BP or something you're doing with the patient. You can definitely go back into best practice, update notes, update conditions, update observations, for example. As soon as you hit finalize, INCA Evo will actually do another sweep of whatever is in the clinical record and get any up-to-date information as well. So you can still also work within your PMS plus also INCA Evo. As soon as it's finalized, it would then try and get all of the up-to-date information.
Fabulous. Thank you.
Okay.
Emma, there's another question being put in the chat. How does the Allied Health get the PIN number to open the document, and does it send an acceptance letter of care plan letter?
That's a good question. So I'll start with the email. So it is a secure email. It's password protected. When they send the email, there is a separate notification that goes along to the provider on how to access it. And in that is a secure link. It's quite complex because it's very secure, but it's a secure link in instructions on how to decipher the password. so it is all up to date and compliant with requirements. And then the sending of the acceptance of the care plan letter. So we send off the template to the provider. So we will send a template to them that says, do you agree to be a part of the TCA? What we found with it is that every allied health and specialist uses a different method to send information back, and they all like their own method. So we just then leave it up to that specialist or allied health provider to send it back to the clinic. We will send that first template to them. However, we don't currently give them a method to send it back because they all use their own, so they can use their own method to send it back to the clinic.
Okay, there's another one here. Is INCA compatible with medical director? Sharon was a little bit late with that one. If you can just update her, Emma.
Oh, yeah, sure. Yeah. So INCA Evo is currently compatible with best practice. We're just starting off with best practice. In future, we hope it will then be available to medical director and ZMed and Communicare as well. So at this stage, it's currently only BP users, but it's definitely on the roadmap to be integrated with other software solutions as well.
There's another one here. Would it be compatible with Apple computers and or Genie?
Yeah, so that's a good question. So that also will come down to hopefully the FHIR capabilities of Genie in the future. We definitely want to be able to integrate with Genie, and it is on the roadmap. However, in order to be able to integrate with Genie, we just need to have that FHIR capability. So hopefully in future, we will be able to integrate with them.
Thank you.
No worries. Were there any other questions at all? No? All right.
None in the chat.
That's okay. I might get into the reviews and then I'll stop again and we can ask some more questions as well. So I'll just bring up my other patient now, for example. So I've got Clara. So as you can see, Clara has quite a large history here. And as I move between patients, my INCA Evo application has updated. And Clara is actually a male. I didn't realize that. But it will automatically update and it will automatically read the patient that you have open in your practice management software. So this patient here, for example, is actually eligible for a review. So exactly the same UI and interface. I, of course, get the patient's consent. But as you can see from the previous care plan, what it will actually do is it will bring in all of that information that was on the care plan. So it still brings in all of those conditions as well, and they can be changed. If something's still not relevant, you might want to remove it. And it will also bring all of those goals from the previous 721. So it will pop them into the actual review. You can add goals, change them, etc., just as I did before in the actual care plan. However, now what I can do is I can tick off. So I'm going to say yes, for example, we have reduced our weight, for example. We are doing this, etc. So I can go through and I can tick off some of the goals that the patient is actually achieving as a part of this review. The other thing that I can do as well is that I can see here the previous visits. So I can see, for example, that this podiatrist was previously assigned 2 visits here. And so I know then, I'm not sure, I can then see, for example, if I want to pop in any other visits as well. Same thing goes as well. So I can still change who, or I can, update who if I want to share that information with the provider. And I can also change my providers. So I could add a new provider if the patient didn't want to see that podiatrist any longer. So I can add in new people to the care team as well. So that's basically the review. As you can see, very, very easy to use. I can add new notes and then I'll set a new date as well for the next review. And then I finalize that one as well. And same thing occurs. So when I finalize the review, it will do a sweep of the information that's in the practice management software. It will pull all of that and put it into the review documentation. And it will then automatically send all of those documents back into the care plan, into the clinical record. The other feature that we're just releasing as well, and we're actually going to release it today, we know that one pain point from INCA Classic was if the patient, for example, came in a day before their review was due, but you wanted to do it then and there and you didn't want to make them come back the next day, we're actually bringing in the feature where you can choose what you want to do. So INCA won't stop you. It will give you recommendations based on the chronic conditions and also the billing that's already in your record, but now it won't stop you from doing anything. So you could actually choose, for example, yes, I know that a 721 has previously been billed, but I still want to do a new one anyway. So I can go ahead and I can do a new 721 for this patient. I can do a new review, for example, for this patient as well. It will pick up previous information from the system, but it doesn't actually stop you or prevent you from doing a care plan at all. Were there any questions at this stage?
Not by the looks of it,
No.
Emma.
Okay, perfect. All right, excellent. The last
hang on.
thing, oh,
Sorry,
yeah, sure.
There is one.
That's okay.
Do authorised have to log into INCA, or are they automatically logged in every day because they have logged into best practice?
Oh, good question. Yeah. So when you have the INCA Evo application, you don't have to log into it every day. So it will open when you open your computer, and what it will do is it will actually read your information on the best practice login. So it will detect, say, for example, if a nurse or a GP is using the system. It would then show, for example, allow you to be able to utilize it. If you have a BP license and you have your INCA Evo license connected when you first start it up, you shouldn't have to log in and out of the INCA Evo application. And just on that one, I just want to also mention, I know that working with IT, no offense to IT, because we are an IT company, but working with IT and getting things installed, it can be quite a struggle sometimes. So what we've done with this INCA Evo application is we've designed it to be a self-serve application. So if you want to, you can still get your IT to do it. Some clinics definitely have, their whole system locked down and IT can only install things. So we can work with IT to get that installed. Alternatively, if you wanted to, you can actually just sign up on the website. You can create an account, and it's as simple as then just downloading the application to your computer. There's a couple of things that you need to tick in best practice to allow that integration and that flow, but it is as simple as, we hope, as downloading, for example, like a Microsoft Teams or using a Zoom. We want it to be super flexible and allow you to be able to use it if you need to, just like that. So it is designed to not be as a strict process as the previous product, and allowing you to be able to actually choose whether or not you want to download it, etc.
Mm-hmm. I've got another one here, Emma, from Helen. She's got, if you are not due for the care plan review, you will not be able to charge it out.
Oh, that's correct. Of course, we're not saying, sorry, Helen, we're not saying that the INCA isn't related to your billing. It's purely just reading the billing that's in your practice management software. We do just find, sorry, my example is, we find that a lot of clinics will have the patient come in today and their review isn't due until next week. So they might want to do it today and then hold that billing until next week. week, rather than getting their patients to come back next week, especially those patients who are very rural or remote. That's what we were just meaning by it won't stop you. You can still continue and complete it. It's then, of course, up to the clinic whenever you'd like to bill it or do that. INCA is just going to allow you if you need to. Sorry, I hope that helps the clarification there.
Thank you.
That's okay. Were there any other questions there? No. The other feature that I just want to also mention is that we know that a lot of clinicians, of course, won't have used INCA before. So there's probably, I think, the stats that just came out was like 2 million care plans or reviews in flight at the moment, so sitting in the clinical record. So the other feature that we've introduced with INCA Evo is that we actually have the ability for you to almost ingest your care plan that's sitting in your practice management software into INCA Evo. We are using some AI and some smarts so that if you did have, for example, a document that is sitting in your practice management software, you could actually put that into or upload it almost into INCA Evo. It would read that document and it would then populate it into that INCA application, and you could then use INCA to do all of the sharing and automatic release to the providers. So because of all of those documents that are sitting in the practice management software, you do have the ability to almost upload it into INCA. It will read all of the information in there, and it would then allow you to use INCA to do the sharing and the releasing out to the providers as well. So a new feature that we've introduced into the system.
We've got another one. Which AI API is INCA using?
That's a good question. That's actually one that I'm not sure of. So I would probably, I'm just a salesperson, Helen. So I might just need to take that question and go back to the developers if that's okay. And I can ask them and get some specifics around which API they use for AI integration. I'll grab your details off Deb, and then I can reach out to you if you like. Apologies, that's one that's actually stumped me. Were there any other questions at all? No worries. I guess probably my last thing that I'd like to mention as well, of course, and Deb and the PHN can reiterate this, but it is fully funded by the PHN at this stage. So if you were looking to join up and you were looking to sign up with INCA, the INCA program, it is fully funded. Nurses, of course, are always included as well. So once the funding, or if the funding did happen to ever run out, you only ever pay for your GP licenses. You don't pay for nurses or PMs or any admin staff. So it is still available post going forward, but nurses and admin staff and administration staff are all included. So one other benefit. Yeah.
Thank you.
That's probably all. I've probably spoken really fast. I probably went a bit too quickly, but feel free to reach out to me if you have any questions. You can always go to our website as well. Our details are on there. I think you can also book a demo or a meeting with me as well if you want some further information. I'm happy to have a chat with you. My details can also be provided by the PHN. But thank you, everybody, for having me.
Thank you. Thank you guys for signing in and listening. It's been wonderful listening to Emma. Any more questions? No? Okay. Can I schedule a time with you, Emma, from Emma?
Oh, yeah, sure. Is that Emma
from Mackay?
Yes.
I'll get her email and I'll send it through to you, Emma, if that's all right.
Yeah, of course. Yeah, that sounds good. Yeah.
Hang on, there's a couple more. Mananda manager said that thank you, looks fantastic. Dr. Andrew Bade, thank you. And Dr. Evan Nichols, just to help me understand which best practice integration does INCA use?
It actually uses the Halo Connect, the Halo Link API. So there's some work we do internally with Best Practice being a premium partner of theirs. So we work with them to integrate with them. We're actually using the Halo Link API to connect with them.
Okay.
Thank you so much for having us. We really enjoyed the opportunity to present.